Hey everyone, this is Mustafa from the Cherry Hill Free Clinic, and the vaccine is finally here and in record time. But is it safe? And should you take it? These are valid concerns and they deserve to be put up against the truth. Fortunately, Dr. Jubril Oyeyemi, our founder, has put together a presentation to help you do just that. It will answer all the questions you have about whether or not the vaccine is safe for you to take, what is in it, how it works, and is it right for you. I hope you enjoyed this presentation, and without further ado, here's Dr. Jubril Oyeyemi to give you fact from fiction about the COVID-19 vaccine.
And just so you all know that this information session is being recorded. Um, and we're going to have Jabril present the information first, and we'll save the questions for the last 30 minutes of the information session. With that being said, I will hand it over to Jabril.
Thanks, Janine. So good morning, everyone. Thanks for that intro, Janine. So in about 10 serious slides or so, my hope is to get some information across to you. And this very first schematic here is really just you've probably seen this if you've had like nursing friends or hospital friends. We are all tired. We are all tired, and really shout out to the nursing team that's really been the hero of this whole fight. But we're all tired, and um, it's interesting to note that the American College of Physicians did a survey last year. They took 1,000 people, and the goal of the survey was to see how many what the willingness to be vaccinated is in the general public. Out of the 1,000 people, about 600 said yes, they're confident in the vaccine. Another 300 said that they're sort of on the fence about it, sort of in the middle. And 1 out of 10, about another 100 people said that nope, they will not be vaccinated. And they looked at what the concerns are from the public out of this 1,000 people. So it broke down as a 6 to 3 to 1, right? And they looked at what are the concerns by the public about this, and what they found was that the concerns were either vaccine specific concerns, so just tell me more about vaccines and give me more information about it. And then there's a crew of people who are just anti-vaccines, period. And that's born out of lack of trust of what's gone on historically and just all of the historical injustice that's been done. And so my Janine's point earlier about when does this end? To be able to get back to what normal is, one of the things that our scientists have taught us, and that the CDC has recommended, is that we need to get to about 80% of the population having immunity to the virus, right? And so the reason that's important is, remember I said you that survey broke down as 6 to 3 to 1. 6 said yes, 3 said maybe, and 1 said absolutely not. Is that to get to 80%, 8 out of 10, the goal of this talk is to give you some information to demystify the vaccine. That's my one goal during this entire talk, because we know that the mind fears what it does not understand, and so we want to demystify what's the vaccine, what's in it, what's the premise of it, so that 6 to 3 to 1, if we can get the 4 out of 10 or the 3 or the 1 out of 10 who are on the fence to understand better, that perhaps they'll make the better decision to vaccinate. So with that in mind, with that one goal in mind, that to demystify the vaccine, I'm going to start with a survey just to get a sense for where we are. I know for some of you this is like preaching to the choir, but again, the hope is that you get information to be able to answer questions from the community at large, from your patients, from your families. So Madly, I'm going to have you put that pre-survey up so we can get a bit of a sense of where people are. So on a scale of 1 to 10, what's your understanding of how the vaccine works? So that's one for, I don't really get it. It's kind of murky. And 10 is, I absolutely understand how the vaccine works. And the second question is, where are you currently? And this is not anonymous. Where are you in terms of, yes, I'm gonna get the vaccine, maybe, or absolutely not. I've read up about it and I don't think it's for me. Okay, so I want to go back a bit. I'm gonna try to make this not too rigidly serious, but it is serious stuff. So what makes what makes a pandemic? There's and this is important. I'm gonna get back to why this initial point here is important. So there's three things that make a disease, a new disease, a pandemic. One is that it's new. So basically that no one's immune system has seen it before, right? We're also naive to it. Number two is that infection or disease process can cause harm and destruction. So basically that it can hurt our body or it could kill us, right? And the third one being, if we find evidence that it can be transmitted from person to person, when you have those three things, that's sort of the recipe for the disaster that's pandemia. So, and I'm going to come back to that. Now, what does an infection look like? What does that look like so far, right? So for the vast majority of folks, it's like the common cold, right? And we've probably read this in articles. It's your fever, sore throat, headaches, body aches, loss of scent of smell, right, or taste, right? And it's in some cases it's a GI manifestation where you're having diarrhea, right? And that's for the vast majority of folks. So if you remember earlier on when the pandemic started, when even the medical community didn't quite understand the gravity of things, right? What you heard was it's like the common cold, right? And that's not untrue. For a good portion of people, it is like the common cold. But then you have that other bucket, the 1 out of 6 people of those who get the infection, according to some reports, who will suffer with the devastation of an inflammatory response to the virus, where there's a lot of elevation in inflammatory markers. There's clotting, there's a heart attack, lung failure, liver failure, kidney failure, right? There's that subset that, and then there's the subset that won't quite recover from that and actually pass away from it, right? And there is no way to tell who falls in what bucket. So if I got infected today, right? Thankfully I'm vaccinated now, but if I got infected, we have no way to know how Jubril's going to respond to the infection, right? I'd hope that it would be like the common cold, but there's no way to know that. Now, I just by show of hands, I know some folks don't have their video on, but by show of hands, right? How many people know someone who's either had the infection, right, or is suffering a devastating complication of the infection, meaning they were either in the hospital or they were on the ventilator or in the ICU, or they developed a blood clot? Or how many people? Yeah, so let's start with that. How many people know people who have had the infection? Just raise your hand. Thank you for sharing that, right? And then my other question is, keep your hand raised if you know anyone who has suffered a complication of the infection, whether they're now, sort of bedbound, or they've got a DVT, a blood clot, or heart failure, or lung issues, or can't work anymore, or can't do the things they used to be able to do. Just by show of hands. I have my hands up. I really have both hands up, really. Family members, co-workers. Then lastly, how many people know someone that's died from the infection? And this breaks my heart. I lost my uncle 2 weeks ago. Lost a co-worker, a nurse at work. There's one in the ICU right now. And again, there's no way to know. There's no way to know. So now I want to share some numbers with you, right? So far, so good, right? Janine mentioned the fact that we know there's been about 17 million infections, right? Of that 70 million infection, and that was actually as of last week, there's been about 1.6 million people who died from this, right? Now, it's a big number, right? But I wanted to, how can we, how can we really understand that a little bit better? So get this. The population in Philly, in the city, there's 1.6 million people in Philly, right? So imagine that everyone in Philly just dropped dead over a short period of time. And there's all these people to bury, there's all these family members. Like, just imagine that. It's graphic, but that's what's happened in the world over the last few months. Or to think about it, Delaware has a million people in it, right? Camden County has about 500,000 people in it, our county here, right? So imagine that everyone in Delaware and everyone in Camden County just dropped, right? And to bring it home to the US, right? We've had, Janine mentioned about 20 plus million infections, and there's been about almost 400,000 people have died, right? To bring that home, that's like the city of Camden has 77,000 people in it. Imagine if 5 times or 6 times the city of Camden has just been wiped off, just dropped dead. I mean, it's a big deal. It's a big deal. And so, for some of the folks who question the numbers that, oh, it's been inflated, it's not real. Well, just by sampling, all of us here who know people or have lost people, we know it's real. We know it's real. Okay, so all right. So we are gonna get a bit more serious now into, this is where the demystifying the vaccine stuff happens, right? So I want you to hang with me. So up here is a schematic of what the vaccine looks like. You've probably seen this in the news, right? You'll see that on the surface of the virus, right, there are these spikes. There's these red spikes, right? And it's called the spike protein. That's what that is, right? Now let me back up a little bit. The whole premise of vaccinations, the whole premise of it is that you have your immune cells in the body, right? Which are the soldier, the battalion that fights infection naturally for all of us, right? What you're trying to do, remember I said that what makes a pandemic is the fact that it's a novel infection, no one has seen it. What you're trying to do is show that battalion, that fighting infections for you. You're trying to tell them that this is what your enemy looks like, right? So that when you see it, you attack, right? Now, what's brilliant about this particular vaccine is that we said, well, what can we show this battalion? This is what the brilliant scientists have identified. So they go, ooh, the virus has these red spikes. Think about it like a red hat, right? You're trying to tell the immune cells that when you see this enemy, when you see this red hat, that's your enemy. Fight that enemy, right? We won't get into the logistics of, trying to get rid of people who wear red hats today. That's another conversation altogether. But just hang with me. So what you're trying to do is to send an email to the body, to the immune cells, right? That when you see this red hat, you fight the infection. It's a foreign body. You go ahead and fight and kill it. That way the body doesn't get harmed by it. Now, this, everyone got that? Have I lost folks yet? I hope not. Yeah, okay, all right. So this other schematic down here is basically, this is you injecting, this is that email. It's called the messenger RNA. Think about it that this is the email you want to send to your cells, right? To identify to identify the red spikes. So basically the vaccine, so now we're going to get into what's in the vaccine, right? So you've got the mRNA, which is the message you're trying to send to the cells, right? It's wrapped up in a nanoparticle. It's a fat particle, which is how a lot of the surfaces of our cells have fat in it. That's how you get a message into the cells, right? It's wrapped up in fat cells, fat particle, a tiny nanoparticle, right? And in that message, there's some tiny salt molecules to basically make sure that the vaccine is in the same concentration as what's called the pH as the cells. That way it doesn't get destroyed, so the cells don't destroy it, right? Is in here. And then around those fat molecules, you have some tiny sugar molecules to make sure that those fat cells don't stick together. That way, when we inject, when we take the vaccine, right, it gets in here, the body sees that email, reads that email, and goes, ooh, you're telling me that this red hat that the vaccine wears, that the virus wears, this red hat is presented here to this triparticle right here, which is blown up. This is your immune cells. So basically, the cells in the body are able to process and see that and read that email. And these immune cells, which is your immune cells that fight the infection for you, they basically ramp up. They make more of themselves. They actually make a memory of themselves, and they store that memory. That way, if you're ever exposed to the virus again, you know that you remember, the cells remember that. So I'm gonna pause for a second here, because I know that can be, I wanna make sure I haven't lost people yet. Good? Okay. Before I go on to the next slide, it's also important to mention that right here to the left here, right, you've got the way things are processed in the body is you've got your DNA, the way it gets translated. You've got DNA to mRNA, and mRNA, which is the message or the email, gets translated into protein, right? It's that step. It's usually never backwards. It's almost never backwards. In some rare situations, but almost never backwards. And I'm going to tell you why that's important later on. In other words, I'll let you sort of appreciate this slide here. I wish I could take credit for it, but I really can't. Yeah. All right. We're gonna get just a little bit more serious now, a little bit more serious. So hang with me. This is a busy slide, but it is well worth it, right? So to the left here is this was published in the New England Journal of Medicine. It's one of the most prestigious journals in the world. It's up there with the Lancet and the British Medical Journal and Journal of American, the JAMA. So this is in the New England Journal of Medicine. This was published. To the left is your Pfizer study, right? And to the right is the Moderna study, right? With both of these studies, I put them side by side. I actually love the way it's written, so you can sort of compare them side by side. With both of these studies, right? Both vaccines are mRNA based, right? Which means it's that messenger RNA, that's that email I said we're trying to send to the cells to tell them what that the virus has this red hat, right? And so so that the immune cells can fight that whenever they see that red hat, they fight, right? So that's the they both have mRNA, the mRNA based vaccines, right? This is a randomized control trial, meaning that all of the volunteers for this study, right? The volunteers did not know whether there were two arms of the volunteers. One arm got the vaccine, the other arm got placebo, right? Both the researchers, who were studying this, and the volunteers did not know, right? So it's sort of a higher level of integrity there, right? In the Pfizer study, there's about 43,000 volunteers, right? In the Moderna trial, there was about 30,000 plus volunteers, right? And the results, which I'm gonna get into in the next slide, is a thing of beauty. But before we get into that, as far as safety, right, which I'm gonna delve into a little bit more also, you find that what a lot of people have is soreness at the site it's injected, which is sort of a local reaction, right? A small group will have what we call systemic reaction to, which is like a mild headache, and maybe some body aches that will last about usually no more than 48 hours. And I actually can testify to that myself, right? And then the efficacy we're going to talk about. Okay, all right. Those of you who know me, right, you know I love photos. I love taking photos, right? This right here was perhaps the most important photo I laid my eyes on in all of 2020. This is it right here. And Dawn and Chung can probably dissect this better than I probably ever could, but I'm gonna try to do my best with it. So what you're looking at, folks, right, is, remember I said in the Pfizer study, which is to the left, this is the result of the Pfizer study. To the right is the result of the Moderna study, right? Is that you took 40,000 volunteers, right? 20,000 got the vaccine, another 20,000 got placebo, right? They were blinded to it. They didn't know they got the real thing or placebo, right? The blue line, or the blue sort of line, really, are the folks that got placebo, right? And this line rising, this is the number of COVID infections after they got what they got on day 0. The red line is the arm that got the vaccine, right? So the 20,000 that got the vaccine, right? You'll notice that after somewhere about 12 days, there's like a split. The arm that got placebo, which is the rest of all, the folks who have not been vaccinated, your average person that's, social distancing, masking, washing hands, right? The rate of COVID infections kept rising, which is what we're seeing in the public. It kept rising. But the red line, the folks that got BNT162b2, which is the in this case, the vaccine, they did not get COVID infections. Oh my God, this is really literally a miracle. And that here is to the tune of the efficacy of it was measured by people who are, smart as, Dawn and Chung, right? Were able to help us measure that and figure out that was not to the tune of 94.8% effective, right? This is on the Pfizer side of it. On the Moderna side of it, right, you notice that the diagram is very, very similar. It's, in this case, the black line got placebo, right? The COVID rates kept rising. The blue line got the Moderna vaccine. And what you're looking at is that, remember I said the way the vaccine works is you're sending an email to the cells for the battalion that fights infections to recognize the virus, to recognize that red hat, not the virus itself, but the red hat, and to say, whenever you see that red hat, fight. What we've learned here is that battalion they learned and they fought, and people did not catch infections. And on the Moderna side, it was to the tune of 93%. So you got 93% and 95% effective. Now, you're probably thinking, well, Jubril, why is it not 100%? Why not 100%? Well, the answer to that is a bit complicated. It's that, well, some people's immune cells, we know when you're going through a stressor, when you're going through, when if you're fighting another infection, we know the immune cells don't learn as well. So the point is, there's always going to be exceptions to the rules, right? But the vast majority of people who got the vaccine in this study, the volunteers who got the vaccine, they responded, their immune cells responded. And this is a beautiful thing to watch. Now, the next slide here, I wanted to answer the question because this is one that my friends and family and, my community members ask me all the time is, were we, people of color included in the studies, right? We know, historically, justice has not been done with that, in that, you'll see studies about medications and they just were maybe 2%, Black and brown folks in it. Well, I'm glad they did their homework, because in this group here, amongst the volunteers, right, there was about 9.2% of the 40,000, right? 9.2% of the 20,000 in the arm that got the vaccine were Black. 9.4% on the placebo side were Black. When you combine the Black with the Hispanic folks in the study, right, you really have, when you add all of this together, it's really about 40% were people of color on the Pfizer side of the study. On the Moderna side, right, that's the Black folks where we were about 10% of those in the study, 10% of the 30,000, and Hispanic folks were about 20%. So when you really add that together, that's good. I'm okay with that. Now, do not do this, okay? It is not funny. Don't do this. You know what's crazy is I took a moment to to look up how many movies have been made between 1950, I think it was 1957, and today about like, vaccines and, viruses causing, a zombie apocalypse, right? There's been about 20 movies made, right? So people are going, gosh, I've seen this plot before. I've seen this before, it's part of the mysticism around the vaccine. But we are here to really learn that forget what's in the movies aside, this is the actual data. Okay, all right, so we get into some Q&As here. These are questions that my friends and family have asked me, that's been out there in the community, which is that, well, Jubril, if you're saying it's so great, right? If it's so great, why are people not sure about it, right? And the first point there is that, people need to get educated. We need to demystify the vaccine and really explain that to people. The other question, the other point here that's worth mentioning is it's new. It's a new sort of a new novel technology, which is that I make the analogy of cars, right? Automobile, right? So 100 years ago, imagine people who rode horses and buggies, right? Who it took you this long to get from here to Delaware, right? Today, it takes you an hour, right? Imagine how much time it took when you didn't understand what was happening inside of an engine. It was like witchcraft, like, really. So, but it takes understanding that, questions about, well, did they cut corners into the study? Is it not safe? Are they, there's all this politics around it. Did they skip steps, right? The truth of the matter is that because of how many people have been killed and how many people this is decimated, there was funding that was sort of accelerated. The phases of the trials were combined such that you still went through that, but you were able to do it quicker because, quite frankly, because it's new technology. Usually what used to happen, and this is worth mentioning, so what used to happen with vaccines is that we used to first have to identify the virus, or identify the virus, right? Try to grow the virus in a lab, right? It takes months to do that because you're trying to get the right cocktail, the right sauce the virus is going to grow in, right? So first you got to figure out how to grow the virus, right? Then you got to figure out how to inactivate the virus, right? Then you got to hope that there's people in the community that are willing to volunteer to get an inactive version of the virus. That's what used to happen. This was in a way, really, for lack of a better analogy, this was the horse and buggy way to do it, right? Now with the mRNA vaccine, we go, no, scientists have figured out that we can simply send an email to the cells about this is the red hat the virus is wearing, right? When you see this red hat, through that email, when you see this red hat, fight. So it's just that's really it. That's why it's happened so much quicker. The other question here that I get often is, well, Jubril, why not just cure the disease? Why not? Why not just cure the disease? And what I say to that is, I don't think anyone on here will disagree with the fact that prevention is better than cure, right? That's really the premise for vaccinations. And so what I say to you is, listen, I don't want for anyone on here, or really anyone really, to have to risk getting infected and trying to fight it and giving them these medications that are potentially toxic with side effects, right? I'd rather just prevent it. I'd rather just show your immune cells that this is the red hat the virus is wearing, and so that it can naturally ramp up and fight the infection. So prevention is better than cure is my answer to why not just cure the disease. There's things about hydroxychloroquine that the president touted for a while, right? Hydroxychloroquine is a medication we use to treat lupus, and we use it to sort of dumb down the immune cells, really to not react so much. And so it's not a safe chronic medicine to take. I would not want anyone to take it, without clear justification. Vitamin D, there's data about vitamin D. Vitamin D, absolutely crucial. As a society, we are vitamin D deficient. I see it all the time. Probably about 75% of my patients are vitamin D deficient, especially, in the winter when we're not exposed to the sun. We should, in fact, eat grains and veggies that have vitamin D in them. but that's also along the sides of prevention, sort of like the vaccine, right? Once you've caught the infection, there's no evidence that taking vitamin D supplements actually helps you do better. We don't have that data that you do, I take that back. There is not cause and effect that treating with vitamin D results in doing better. What's been found in that data that was shared around was that in people who did worse, they were likely to be vitamin D deficient. But that's different from, does it treat the infection? That's two different questions altogether. The other thing the other question I hear often is, well, what about Jubril? What about herd immunity? What about that? I just want to, I just do what I've been doing. I'll just lay low, stay home, and wear my mask, wash my hands, and I'll wait for this to die down in a year and a half, right? Well, what I say to you is this, is that if after learning all of this, right, and if after having all the information, right, you decide to do that, then I'm at least, we're at peace. I know that we've done some due diligence, right? What we want to do is but my answer to that is that for us to get to that 80% of the community, which in the US would be about 220 million people, to be immune to the virus, right? That means many more people will have to die, which one death is one too many, right? And right now we're already at, from what Janine just said to us, there's been almost 400,000 people that have died, right? And there's only been 20 million infections, right? Now, just think about the math of what it'll take for us to get to 330 million, right? And how many more people will have to die. And God forbid, I don't want any one of us or our family members to have to suffer that. The other question here is, well, Jubril, is there a chance for autoimmunity, which is, basically, is there a chance that later on, a year, 2, 5, 10 years from now, is there a chance that because I got this vaccine, my cells start to fight themselves, that my body starts to fight itself, right? My answer to you is that email message that's in the vaccine, that mRNA message that's in the vaccine, right? We know from studying it that it disintegrates. Like that email doesn't stay, it doesn't linger. The machine within our cells, once it reads the email, it disintegrates it and it's gone. So there's really we're not expecting that, although we will keep monitoring that, okay? And then the next slide here goes into the what I call an infodemic. There's a pandemic and then there's the infodemic out there, which is well, does it, is there fetal material in it? Is there DNA in it? Are there antibiotics in it? Are there blood products? Are there microchips in it, right? And the answer is no. The answer is no. We already talked about what's in the vaccine. I heard you're skipping steps to make the vaccine more quickly, right? I think I answered that one already, that this is new technology. So this is like your electric car versus your we know that's the future, right? We know that's the future, but it takes time for something new, right? It takes time to sort of adopt new technology. Even when we know clearly it's what's better for the earth, it's what's better for us. Can mRNA vaccines change the DNA of a person? The answer is no. The answer is no. Remember, I showed that schematic. It goes DNA to RNA to messenger RNA to proteins. That's the sequence it goes, right? Your mRNA vaccine cannot go backwards. It just does not work that way. And then the other question is, how do we know there won't be side effects down the road? Well, we're monitoring things, right? But all the early indications based on how this email was sent into the cells, based on how it works, there's no indication that there should be some unexpected side effects. Now the CDC has put things in place to sort of monitor folks that have got it, but we know it works. We know it works, and we know it prevents the death and destruction that's happening currently. Can I get HIV from the vaccine? Absolutely not. That's something else entirely. That has nothing to do with this mRNA vaccine that I am talking about, that we're talking about today, the Pfizer and the Moderna vaccine. That was, I can talk more about the history behind that, but that is not relevant to the current vaccines. I know, guys. I know that. I know it's a lot. I know it's a lot of information, but we're almost there. We are almost there. So the reason, there's only one reason I put the slide here up. This is the Pfizer side. This is the Moderna side, right? The question was, did people die from receiving the vaccine? Right, and I'm going to talk about there's two cases I'm following right now. Janine and I talked about this just before the talk. There's the case in Chicago, right, and there's a case in Florida, and I'm going to talk about that. So in the Pfizer arm of the study, you see that there were two arms of the study. There was the arm that got the vaccine, which is this arm here, right? The 18 or almost 20,000 that got the vaccine, and there's the 18,000 that got placebo, right? Two people died in the group that the placebo group that did not get the real deal. Two people died, right? On the vaccine arm of it, right, one person died, right? All three deaths, right, were investigated, were found to not have anything to do with the vaccine, but for the fact that if you were to pick 40,000 random people in society and watch them over 2 months, right? It's the unfortunate reality. No one knows, how much time you're promised and who's going to pass away within those 2 months. That's what we found in looking at that, right? And so that's worth mentioning. Two people died who got placebo. One person died who got the vaccine, and all three had nothing to do with the vaccine. That, I want you to remember that. I'm going to come back to it. Okay. So if you've heard all that and you're still like, Jubril, yeah, I hear you. That's good information, but I still think, I think there's a good chance it's going to be like the common cold to me, and I think I'm just going to wait it out. I'm like, okay, I hear you. I hear you. But I want to make sure that you're with that common cold, that you're aware of it. So what I did here was to put side by side. These are symptoms of complications from the infection, or pretty much symptoms. And the first 11 are symptoms from the infection, if you actually wait and caught the infection. So you got your fevers, your headache, your fatigue, your body aches, your dysgeusia or ageusia, loss of taste or smell, sore throat, congestion, nausea, vomiting, and in some cases diarrhea and shortness of breath, right? But like, I can handle that, right? But wait, this is where it gets tricky. 1 out of 6 people in some studies this is where the bad stuff happens, right? This is your pulmonary failure, ending up in the ICU on a ventilator. This is your blood clot, your confusion, your heart attack, pneumonia, liver failure, right? All these really, really terrible things, right? That happen, and we can't tell who this happens to, of everyone who catches the infection, right? On the right side of it, I put what the potential side effects, of the vaccine are, right? And it's two things. It's local reaction, and in some cases systemic, where you get a headache and body aches, right? And the most serious side effect, which has been anaphylaxis, which is a severe allergic reaction where you need an EpiPen to and to really monitor people, right? It has happened as of last week, because I'm following this data. As of last week, there were 5 million people who were vaccinated, right? Of those 5 million, 29 cases of anaphylaxis. Those 29 cases were people who we knew had a history of an allergic reaction or anaphylaxis to other things, right? Which is why the CDC and Dr. Fauci came out and said, slow down. If you've got a history of anaphylaxis or allergies, maybe you should just chill out for a bit, right? But that's important, because based on those numbers, right, that means 11.1 out of every million are the folks who had an allergic reaction, right? I tell you what, food allergies, strawberry allergies are much more common than that, right? Of every million, 11 people had an allergic reaction. So when you look at it from that perspective, you understand a little bit more. You know what's more common than 11 out of 1 million that had the reaction, right? Water intoxication. Like not too many people know that that's a thing. You can become water intoxicated and actually die from drinking water. And actually, they've studied in 2003. they did a study of people who ran the Boston Marathon, and 13% of them actually were water intoxicated by the end of the race, right? But we all drink water. I'm not saying don't drink water. Jubril's not saying don't drink water, please. But my point is, you have to sort of put it side by side next to some of the things that we know to make a better decision. Now, this is my final slide. This is, well, Jubril, there's mutations out there. There's mutations. Should I be worried, right? And I will say, though, that the reaction in the medical community, it's not this, right? It's not this Jubril emoji here. It's not that. It's probably maybe this, the facepalm, which is like, okay, we know it's going to happen, right? Viruses mutate a lot. That's, what happens is because the virus copies itself so much and makes so many copies of itself, it makes mistakes and it mutates. Those mistakes are what mutations are, right? But here's the thing. Sometimes, what's shown in the movies is that the virus mutates and gets stronger, right? But more often than not, the virus actually will mutate and actually get weaker, right? So what we're doing right now is we found these variants. We found a UK variant, a South African variant. There's even a Nigerian variant. So my people. But the CDC has an entire department that's like dedicated to studying these variants, and we have not found evidence yet that the variants, the mutated strains, have learned to evade the vaccine. We have not found that yet. So the recommendation is still, the strong recommendation at that is still to get vaccinated. And then this is it, I promise. So which is that, I love this quote by Maya, which is, we were all social distancing, we were all putting our mask on, washing our hands, right? But now that we have a better way to fight this terrible thing, right? We found this cool, smart way to send an email to our cells, our immune cells, to identify the virus. I think we got to do better. I think we got to do better. And so, I got my first shot. I was so excited to get my first shot 3 weeks ago. Last Monday, I got my second shot. And, what I did have, I had the local reaction. My arm was sore. I took some Tylenol, right? And you do get a bit of, I had a slight headache yesterday in the office, right? I took some Tylenol, and that's it. And to be able to have the protection from this terrible virus, I would do that all over again. And actually, I got a crazy story to tell you. I was in the office, and one of my patients had a mask on, right? This is after I got my second dose. They sneezed, right? And we know what that is, right? When, in COVID world, if you a sneeze is like, even for a provider. And I was like, you know what? Like I'm protected, So what I hope for all of you is that peace of mind for us to be able to return back to normal, whatever normal is going to look like. But we got to get to 80% of the population to be protected from this thing. Sorry, that was longer, so much longer than I thought I would talk for. Can't believe I just talked for 40 minutes, but yeah, we'll open it up now for questions. Let's do the survey, Madly. Let's do a survey now.
We'll give it a couple more seconds and then I'll end the poll.
I want to say thank you to Jubril for putting together this very informative vaccine session. It's so much information, and I learned even more the second time watching it. So at this time, if you have any questions, please raise your hand. Nate, is that a hand clap or a question?
That's a question.
Okay.
Jubril, I have a history of anaphylaxis reaction, bee stings, kiwi, pineapple, latex. Should I just bring an EpiPen when I get my vaccine, or should I let them take care of that?
So that's a very good question. Very good question. So a lot of the locations, I got mine at the virtual vaccine site, and they're actually having folks, they're prepared to sort of handle it. They're having folks wait a bit, even when the folks that don't have a reaction. I waited 15 minutes. For those who had a reaction, they actually wait an hour, right? Just to be sure that all's well. But so depending on my answer is, depending on where you're getting it done, Nate, I'd say I will take the EpiPen. I would let the team know, and you'll be monitored. Yeah, I do think that for the protection it offers, it is, in my opinion, it's worth it. It is worth it. It's sort of like when we desensitize people in the ICU, you know, if someone has a peanut allergy and we desensitize them under a controlled setting, right? We understand that the desensitization process is worth, you know, putting their body at that risk of an anaphylactic reaction. And I gotta say, in 10 years of doing desensitizations, I actually haven't had a case where we had to intubate someone. You know, usually we're able to monitor it and catch it early on. So I would rely though on the team where you're getting, you know, where you're getting the vaccination done. Good question, man.
All right, Hannah has a question.
Yes, I think I heard somewhere that the vaccine will only provide protection for like a year or 2 years. Is that true, or is it ongoing?
Yeah, that's a very good question. I think that's part of what, Hannah, that's part of what we're looking forward to finding out, because right now the recommendation, even for folks who have been infected with COVID, is to get vaccinated every, you know, I think something like 90 days after the infection, it's recommended to get vaccinated. And the reason for that is because, remember I said you're sending this email with the vaccine, right, to your battalion that's fighting, right, to identify that red spike protein, right? And but when you get the infection, we don't know what that battalion has learned, you know, whether it's the M protein, the spike protein, whether it's just the shape of we don't know. You know, we know you can measure antibodies, right? But measuring those antibodies, it's sort of proxy for protection, right? We don't know for sure how long that's going to last for. But with a targeted approach with the vaccination, right, the hope is that the B cells, that the battalion in the cells, that the B cells, the plasma cells in the of the immune system, that they will store that information, that memory will linger, right? How long it lingers for, we will find out, and that's why the CDC continues to monitor that. But I think anyone that says a year, 2 years, it's really speculation, it's conjecture, really. But we'll find out. Yeah.
Are there any other questions, comments?
I have a question for the folks who already took the vaccine. Were you a little anxious when you went to take the vaccine? Yeah, I'm going to take mine, but I mean, I believe in science and everything. I know how it works, and I'm going to take it. But but I'm still like, oh, it just is a little anxiety. So, in general.
I haven't gotten the vaccine yet, so I can't answer that question, but I am going to get the vaccine, and I do have some anxieties, and it's just me anyway with any vaccine. But I think if there's anyone on the team who wants to speak to that, who's actually received a vaccine, they can answer that question for you, Yasmin.
Yeah, I think a few of our team members have got it. I'm gonna let someone else take this one. You know, Kathleen, I think I want to say I think Natasha, I think you did also. Yeah, please go for it.
I mean, I wasn't anxious or I was more excited. I've been, as a lot of you know, I've been like really engaged in our vaccine survey, talking to the community about building vaccine confidence. I'm like pretty interested and excited in about vaccines. So I wasn't anxious going in. There is like in the very back of my mind, this question of like, even once we, you know, a number of us have the vaccine, like, you know, I was talking to my therapist yesterday and she was really excited. She got her vaccine and we're talking about like seeing each other in person for the first time in February. What I'm a little nervous about is like, is it really going to work? Like, you know, and I know on paper that it is, but it's more that process of like, how is it going to feel for us all as we move through kind of this long year of, you know, building up herd immunity, getting enough people on the same page, like we're still going to be wearing masks. So I didn't feel anxious about that process. But yeah, there are still some like lingering questions about what is it going to feel collectively as we move forward. But I'll let others chime in as well.
So I was a little anxious. I was a lot anxious. So I had to call Jubril to calm me down. just because of my diabetes, and I was more nervous of all the side effects of the vaccine. But then, you know, I was okay once I got there. And the team at Camp Care made things more comfortable as well. So.
Thanks for sharing that, Maritza. You know, it's worth mentioning though that when you feel that that soreness, right? Or in some cases by the second dose, my second dose was slightly worse with I had a bit of a headache in clinic yesterday. It's actually a sign that your immune cells are ramping up, like they're doing what you want them to do, you know? So when it's happening, you know, if it does happen, some people didn't, but some people did feel that, right? Just remind yourself that no, not a, oh gosh, why did I do this? It's more like, okay, my immune cells are naturally ramping up to do what we want them to do. So yeah.
And Hannah has her hand up.
Yeah, just one more question. Is there a time frame limit between when you can receive the first dose and the second dose? Like if you were to receive the second dose more than 4 weeks after, does that affect anything about like its efficacy or?
Yeah, that's a very good question, Hannah. That's a very good question. And actually what we found was that for the Pfizer vaccine, right, it's 21 days apart. For the Moderna vaccine, it's 28 days apart, right? And what we found is that after the first dose, you're about 88.5% protected, right? And in the second dose, really when you sort of, you know, fire up those B cells, right? You know, that's when they're really like, okay, we got it, you know, 95% protection now, right? And so what we don't know right now are, and there's people who are saying, hey, listen, there's not enough of the vaccine right now. Why don't we all just get one dose and 88% protection is good enough so we can get more people vaccinated, right? I think that's a whole nother conversation. I'll let the policy folks deal with that. But we don't, what we do know is at the very least for folks who will only get one, and for whatever the reasons are, you know, life reasons, or, you know, for some reasons they couldn't make it back to the second shot, they're still protected. But based on the data, we know you're more protected if you get it at that time frame. There's no harm in getting it later. I can't imagine any harm in getting it later. You might not prime the immune cells as well as you would based on what we know from the study, but we'll know more about that also, because I think, you know, 6 months from now, we'll probably have, I don't know how many millions of people vaccinated, and I'm sure there's going to be a subset of those that missed the second dose, and so we'll be able to answer that question.
So it looks like AHC team has a question. I'm not sure who's behind there. And I know that we're at time, so if anybody has to hop off,
this is
we understand. Hi, Andrew.
Hey, so yeah, I guess my question around, as you're talking about sort of the 90% effectiveness, is that 90% effective means that 90% of the people who get it will be protected, or it's a personal, like for me personally, it's 90% effective. You know what I'm saying? Like,
that's a good.
Like, if it's effective for me, it's effective, but we know that across the population, it'll only be effective for 90% of the people. But with a second dose, it'll be effective for 95% of the people.
Yeah, so it's my understanding of it is it's more the latter. It's more like of the number of the almost 20,000 people they studied, right? Remember that graph, it was the red one for people who got the vaccine stayed flat, right? And it was a slight bump here, but it still stayed flat, right? So it's more the latter in that of all the people they studied, you know, 95% of the time when when you got the vaccine, you were protected. You did not catch the infection. That's my understanding of it. Mm-hmm. Now, as for in the 5% of the time where people still caught the infection after getting the vaccine, there's a few theories also about that. One of that was what I said, which is that people, you know, based on what you're going, like we know if you're stressed, your immune cells are weakened, right? We can't explain that, but something about the cortisol levels in the body and the immune cells and the sugar levels, right? We know that if you're fighting another infection, even if it's minor, right? So if you have to tell the immune, if while the immune cells are fighting something else, you tell them to go kind of ramp up and do something else, they don't quite do it so well, right? We know that also. And the other thing we think is happening is that if you've got the vaccine, there, even if you were to become COVID positive, right, the severity of the infection is also likely to be less because you have some, some degree of immunity, but it's not perhaps so strong, right? So there's still a benefit in even for the one where it seems to have failed, there's still a benefit in it. If that makes sense.
Yeah, no, that makes a lot of sense.
Jess, do you have a question or?
I do.
Okay.
Jubril, I wanted to ask a question regarding I'm on methotrexate for rheumatoid arthritis. So I've been concerned with taking the vaccine because of the methotrexate. Should there be any concerns with, like, do you stop the medicine when you're taking it, or just because like my provider has told me to not take it if I'm around someone who's been who has had COVID, so it's like a lot of restrictions with it.
Yeah. Because the way methotrexate works is it sort of tames the immune cells, the immune system, so that they're not raging, so to speak, right? So that is one I would probably look. I personally would probably phone a friend on that, meaning I would have rheumatology chime in on, if we're to hold the methotrexate, right, how long to hold it for before getting vaccinated, and what's a good time frame to resume it, to allow, is it a month after, right, to allow the immune cells to have learned. So these are very, very like technical questions, and depending on the the severity of the disease process, right, is it even safe to hold it? Like, these are very, very, very particular questions, but it's a great question. But I would rely on rheumatology to help me answer that question in your case, which because it's a very, very specialty question, and it's not just methotrexate, but we're also talking, potentially people who have diagnoses where they're on immunosuppressive agents, like people, for example, who've had like transplant, right, who are on prednisone and one of the other, cell-sept Prograf, right, things that depress the immune cells, right? How do we go about doing that? I think that's a very, we still want those members of the community protected, but we want to do it probably with some extra help, with some extra consults, on the case.
And there are a couple comments. And again, if anybody has to hop off, we do understand. We appreciate you, those of you who are able to stay on. So Yasmin's comment is about newborn babies receiving 2 doses of the flu vaccine. First dose primes the immune system, second actually provides immunity. Tanisha's question is, Jubril, are you concerned with the 73 million young adults under the age of 18 that cannot get the vaccine?
I am. I can't wait for us to and I get it why the researchers thought to simplify the study and look at adults adults and exclude pregnant women, because it can get complicated to really narrow down on your results. But I can't wait, because again, based on how the vaccine works, right, based on the idea of the premise of sending this email to yourselves, right, I see no reasons. I don't see any reasons why it would be any different for kids. I don't see any reason why it will be any different. For pregnant women, it's a little bit dicey, because we know that in a pregnancy state, you have a lot of extra hormones that can sometimes affect the immune system, right? So that gets a little bit, that needs some specialty attention. But for kids, I can't wait for us to sort of remove that restriction and go, okay, here's the dose that works. Here's the dose. Is it the same 0.3 mLs, very tiny dose, is the same 0.3 mLs, or is it less, or is it more? So that's what I think is yet to be figured out. Dosing, it's kind of like how you give an adult, you can give 650 milligrams of Tylenol to an adult, right? But you want to modify that dose for based on age. I think that's part of the complication of it also. But I can't wait for, to be able to protect our young ones as well.
Any other questions, concerns, comments? Terry has a question.
Just a really quick question. Is there any hesitancy about getting any type of medical procedure or anesthesia in between the two shots or directly after one of the shots?
I am not aware of that. I'm not aware of that because a lot of the anesthesia, whether it's local or general anesthesia, right? They're not known to depress the immune cells. They're not known to and because the vaccine is an email you're sending to the cells, to the body, right? I'm not aware of any anesthesia that will do that. Now, what I might be concerned about is what the procedure is for. Because see, if it's a major procedure, remember I said, sometimes the immune cells aren't there like at 100%, right? We know when you have surgery and you're cut or, the immune cells have to kind of work, to heal, and you're in a stress state also during the procedure. So if anything, that might have something to do with, an immune response, right? But the anesthesia itself, so say for example, if I was going to have, if I have like a disc disease in my neck or my back, and I typically get some anesthesia to get some steroid injections, I don't see a reason why that would affect getting my second dose or my first dose of the vaccine.
Again, if you have any questions that you want to ask personally to Jubril, feel free to send an email. And again, thank you all for your time and have a great day.